Okay, so you've got 3 months until your SCA. The clock is ticking, you already know the format, you know what's at stake. So the big question is, where do you actually focus your energy? This isn't about just cramming more guidelines. This right here, this is your blueprint to the high-yield skills that genuinely make the difference, the things that separate a clear pass from a frustrating fail. So let's get right into it.
Here's how we're going to break it down. We're going to build what I like to call the mastery pyramid. We start with the absolute foundation, which is relating to others. From there, we build up to the next crucial skill, data gathering. Then we hit the very peak, which is clinical management. And finally, we'll wrap it all up into a practical 3-month blueprint you can start using today.
You know, the most important mindset shift you can make is right here. The SCA is not a knowledge test. Let me say that again. It is not a knowledge test. The examiners are working from the assumption that you already have the knowledge. What they're really assessing is how you apply it, how you think on your feet, and how you act like a safe, effective GP when you're under pressure. It's all about showing what you can do, not just listing what you know.
All right, let's start at the base of our pyramid. This is the absolute bedrock of every single successful consultation, your interpersonal skills. If you get this part right, honestly, everything else that comes after just flows so much more easily. This is where you build the trust that you need to properly investigate and manage what's going on with the patient.
Let's really zero in on that word, harmonious. Rapport isn't just about being nice or polite. It's about creating a genuine, harmonious understanding. You know that feeling when the patient just relaxes, they feel heard, they feel like you're on their side? When you create that atmosphere, communication just opens up. They'll tell you what's really on their mind, and that information, well, that's absolute gold.
Look, the examiners can spot a scripted, tick-box approach from a mile away. It just feels clunky. You ask a question, you get a reply, you move on to the next item on your mental checklist without really listening. A shining candidate, on the other hand, is genuinely curious. They're responsive. The consultation becomes more like a dance than a march. You're showing a real desire to understand, and that is a core skill they are looking for. I want you to think of your curiosity as a diagnostic tool. Being genuinely interested is how you uncover all that vital psychosocial context. Why do they come in today of all days? What are they secretly worried this might be? This is how you really dig into their ideas, their concerns, and their expectations, their ICE. And that is absolutely fundamental for building a management plan that they'll actually follow. Okay, let's move up to that next layer of our pyramid. You can see how this all connects. Once you've established that solid rapport, you can now move into a really effective investigation. This is where a candidate who's going to pass with flying colors really shines. They showed they can systematically, safely, and efficiently uncover the information they need to make a good decision. A high-scoring consultation always has a clear, logical flow to it. You see it every time. You start broad, right? Open questions, let the patient tell their story in their own words. As they're talking, you're exploring their ICE. Then, and only then, do you start to narrow it down using focused, closed questions to test your ideas, and of course, to systematically rule out any red flags. This structure isn't just for show. It demonstrates safe, logical clinical reasoning to the examiner. And this is the difference it makes in practice. The scattergun approach just feels chaotic. To the examiner, it looks like you're lost, or even worse, panicking. But a systematic approach shows that you are in control, that you're thinking clearly. And you can use simple tools to show this, like signposting. I'd now like to ask some questions about your headaches, and then summarizing every so often. So just to make sure I've got this right. It confirms you're on the same page and that you're processing the information correctly.
Here's a perfect, concrete example of how to elevate your performance. Asking, "Are you on any medication?" is fine. It's okay, but a candidate who's really excelling has done their homework. They'll say something like, "I can see from our records you're on metformin. Is that still correct?" This tiny little change does 3 amazing things. It shows you've prepared, it saves time, and it builds the patient's confidence in you. It's a small detail, but it has a huge impact. Now, let's talk about a really powerful technique, thinking aloud. Sometimes the questions we have to ask, especially when we're checking for red flags, can seem a bit random or even scary to the patient. By verbalizing your thought process, you're essentially letting them and the examiner peek inside your clinical brain. You're showing why you're asking what you're asking. It demystifies the whole process and scores major points for demonstrating your reasoning. Just look at a beautiful phrase like this one. It does so much work in one short sentence. First, it acknowledges that the questions might feel strange. Then, it explains their purpose, to check for serious stuff. And
Brilliantly, it links directly back to the patient's own fears, their C from ICE. This is just a masterclass in building trust and showing a sophisticated patient-centered approach.
And here we are. We have reached the peak of the pyramid. You've built that connection, you've systematically gathered your data. Now it is time for the final, decisive action, turning all that great work into a safe, patient-centered, and totally defensible management plan. This is where it all comes together.
So, what does a passing-level management plan actually look like? Well, it's about way more than just picking the right drug. The keywords to remember here are prioritization, self-management, and continuity. This shows the examiner that you're not just treating the problem in front of you today, you're thinking about the whole person, about their future, and about what happens next. So here it is, your checklist for an excellent management plan. It has to be built around the patient's ICE. It applies guidelines intelligently, not just like a robot. It's safe, always considering other health problems and medications. And the two big ones, it includes a specific, tailored safety net, and it arranges sensible follow-up. A plan like this just screams competence. This is such a subtle but absolutely critical distinction. A really common trap is to just list off a few options and then ask the patient, "So, what do you want to do?" That's not shared decision-making, that's just abandoning the patient with a tough choice. Your role is to support them. Use your clinical judgment to gently guide them towards a decision that's not only medically sound, but that actually works for them and their life.
This phrase is the perfect example of that supportive approach. You're not ordering them to do something. You're offering your professional opinion in a gentle way. As your doctor, I am wondering if... It shows you're thinking about their whole situation, their job, their stress levels, and you're framing your advice as a supportive suggestion. This is the language of a truly collaborative GP.
Okay, let's talk about safety netting, because this is where so many marks are won or lost. Vague advice like, go to A&E if it gets worse, is just not helpful and can actually cause a lot of anxiety. A strong candidate gives specific and tailored advice. They explain what to expect, over what period of time, and exactly what specific symptoms should make them pick up the phone or go to A&E. It's clear, it's reassuring, and most importantly, it's safe.
All right, we've made it up the pyramid. We've seen how a top-scoring candidate builds rapport, investigates like a detective, and manages collaboratively. Now, let's pull all of this together into a clear, actionable blueprint for your next 3 months of prep.
So, here it is. Your blueprint. For the first month, I want you to focus only on the foundation, rapport. In every single practice case, your one and only goal is to be curious and build that connection. Don't even worry about the perfect diagnosis. Just master that. In month 2, you build on that foundation by layering in systematic data gathering. Practice your signposting, your summarizing, your thinking aloud. Make your reasoning visible. Then, in the final month, you bring it all home by focusing on creating those safe, collaborative management plans. Practicing in these layers is how you make these complex skills feel second nature. This is where the exam is won.
And that brings us to one final thought. Just look at that pyramid one more time and think about the blueprint we've just talked about. I want you to be really honest with yourself. For this first month, where does your focus need to be? Is it about building that initial curious connection? Is it about adding more structure to your questions? Or is it about crafting those really supportive and safe management plans? Pick one. Just one. Because making small, focused improvements, one layer at a time, is what will get you that pass in 3 months. So, which skill will you master first?